Chat is enabled. All right, we got a message coming through. Okay. So we'll give Armando a second to give us the message, and then we'll go live. TGIF, if that still counts. All right, so we're ready to go. Good morning to everyone tuning in. I'm Adam Diaz, organizing Department Warehouse Workers Resource Center. So let's start with a little bit about the organization bringing us all together today. The Warehouse Worker Resource Center is a nonprofit organization dedicated to supporting warehouse workers and their families in Southern California through education, advocacy, and action. Again, education, advocacy, and action, which we'll be doing today. For the past decade, WWRC, as we're known, has supported thousands of non-union workers in the supply chains of Amazon, Walmart, and other retailers. We bring workers together to demand better conditions in their workplaces, including fighting wage theft, health and safety violations, discrimination, and other workplace issues. So we're here today, obviously, in the midst of the coronavirus crisis, because we see workers in warehouses across this country facing unsafe conditions, but not being provided with clear direction from their employers or the state. Workers at Amazon warehouses, including Aunt 8 in Moreno Valley, have been exposed and infected. Amazon workers, we care about you. We want to share with you how best to protect yourselves and your coworkers. Again, we care about you. Amazon workers, turn to each other now, care about each other as well. And to us at WWRC, check in with each other often, now more than ever, because you're the working class holding us together. You're still going to work every day. You continue to move and process the basic things we need. You're among the working class holding us together, who still go to work every day, delivering packages to upwards of 200 households a day. You work for the wealthiest corporation in the history of the world, the wealthiest CEO in the world. And it's a corporation which continues to profit directly from this crisis, but in many cases doesn't even provide basic protective equipment necessary to keep you safe. And because your rate of productivity is constantly monitored, measured, and tracked, your employer doesn't even give you enough time to wash your hands during a global pandemic. I repeat, because your rate of productivity is constantly monitored, measured, and tracked, your employer doesn't even give you enough time to wash your hands during a global pandemic. Folks out there, how does that make you feel knowing this? So warehouse workers, you're being told you're essential to our economy, yet at the same time, you're being pushed to work harder and without protective equipment or the direction on how to stop the spread of this disease. Now, obviously, we see corporate negligence like this as a threat to public health in general. Corporations who refuse to protect their workers, to give them tools, information, and a basic knowledge of their rights necessary to remain safe during these times. We see corporate negligence like this as a threat to workers like you. We're being asked to place yourselves at risk in the name of corporate profit. That's where WWRC steps in. We're here today because we care about you. We're here today to help educate you on your basic rights and offer ourselves as a resource. Obviously, throughout the day and as you watch this, as it gets shared on the internet, feel free to message us through Facebook or call me directly. Adam, numbers up there as well, area code 213-674-0383. Again, 213-674-0383. If you need anything at all, that is my direct number. This session will run about 30 minutes. Please make sure to share it again with everyone you think could benefit from it. If you want to ask questions, you can do so in the comments, and we'll try to answer them live. We're going to have 4 speakers today. Dr. Adolfo Aguilera, RUHS, Moreno Valley Community Health Center. Tim Shaddix, the WWRC Legal Director. Dea Gracia Cornelio from the UCLA Labor, Occupational Safety, and Health Program, also a WWRC board member. Steve Scardino, a partner and workers' compensation attorney from GEC Law. So with that, we'd like to start with some best health and safety procedures. with Dr. Aguilera from RUHS Moreno Valley Community Health Center. Doctor, take it away.
Thank you. As mentioned, my name is Adolfo Aguilera. I am a family physician for the Riverside University Health System. I've been asked to provide some information regarding how the public and warehouse workers can remain safe and healthy in the midst of this pandemic. So as most of you are aware, our government officials have declared this pandemic caused by COVID-19 a national emergency. As a result, you may be experiencing some safety measures that will affect you and your family in some way or another. For example, the closure of schools and certain non-essential businesses. I would take this seriously and abide by the recommendations that are being set forward. This virus pandemic is alive and spreading within our local community, and we are seeing the numbers of cases increasing and increasing. So all of these measures are in hopes to slow and stop the spread of this virus. We do know that this virus is spread mainly by person to person through respiratory droplets. Therefore, here are some measures that you can do to help protect yourselves and others. So first, wash your hands. You can't do enough washing of the hands, and you want to do this with soap and water. While you're washing your hands, the recommendation is to take 20 seconds when you're doing it. And usually I say if you sing happy birthday 2 times while you wash your hands, that's the recommendation. If soap and water is not available, then hand sanitizer would suffice with at least 60% alcohol. And when you're using the hand sanitizer, make sure that you let it dry off and don't wipe it off. Second recommendation is avoid close contact and practice social distancing. Basically what this means is remain at least 6 feet away from others and avoid crowds. This is important in the workplace, especially because we're all used to, during lunch breaks to eat with one another. Even in places that I walk by that are having lunch breaks, I see people congregating and eating lunch together. I would definitely recommend for social distancing also to be practiced during lunch breaks and while at work. You want to use proper coughing and sneezing etiquette. This means basically cover your mouth when you cough or sneeze. You're going to cover that with your hands, you're going to cover that with a tissue, you're going to cover that with your elbow. And this is basically to prevent the respiratory droplets from going far and affecting others. If you do cough or sneeze, I would recommend again to wash your hands after doing it. The fourth one is clean and disinfect frequently touched areas. These may include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and or sinks. I think this is going to be very important to do on a daily basis so that we can essentially be practicing, again, hygiene for safety. And then lastly, if you're sick with any infectious respiratory symptoms, please stay home. This means if you have a cough, if you have a new onset of runny nose, congestion, shortness of breath, fevers, body aches, and the such, the recommendation is for you to stay home. I would definitely call your work, let them know that you've developed these new onset of symptoms, and the next step would be to contact your primary care provider. At that point, you can get recommendations from your primary care provider as to what the next step would be to determine if you need to be tested or not. So that pretty much finalizes the basic recommendations I think that you can do to help keep you and others safe. I hope that these recommendations have been made clear. These are times when we have to be selfless and we have to think about our most vulnerable population, who are the elderly, who are those who have chronic conditions, who may have immunocompromised states, who are at most risk from having the worst complications. I appreciate this opportunity to be able to give you these measures, and I hope everybody stays safe, practices these safety measures so that we can curtail the spread of this virus. Thank you so much, and you have a wonderful day.
Thank you very much, Doctor. Again, thank you to all our brave frontline healthcare workers who continue to put themselves in harm's way for the benefit of us and our health. Again, to underscore what I heard was hand washing, allowing for yourself to sing happy birthday twice for that duration, or if not possible, hand sanitizer, not wiping it off and allowing it to dry. So to workers out there, that means the time to do either continually. So obviously these things that we've talked about are minimal protections. You and your coworkers obviously have the right to ask for whatever makes you feel safe. We don't know everything about this disease yet, and neither does your boss. That includes Jeffrey Bezos. We cannot sacrifice your health to the company's bottom line. The expansions are great, but limited in terms of our protections. We still need to organize, get together, check in with each other, see how each other's doing. In the morning at the start of every shift, turn to the person to the left and right of you, ask what their name is, exchange contact information, check in with each other. Now's the time for social solidarity. And so we're going to talk now about ways to organize to make your employers do the right thing. And to explain that is the WWRC Legal Director, Tim Shaddix. Take it away, Tim.
All right, thanks, Adam, and hello, everyone. So the first thing I want to say here, if we're talking about rights, is to remind everyone that you still have essentially the same legal rights on the job you had before, even though we're in an emergency situation. And this includes the right to safe and healthy working conditions. Before I go into the details, I just want to note that what I'm about to say is only meant to provide general information. Although I'm an attorney, this should not be taken as legal advice for your individual situation, because there's always different wrinkles in everyone's situation. So should contact our organization, WWRC, or consult with another attorney if you have legal questions about your own particular case. All right, so that said, let's talk about your safety rights you have as an employee. Now in California, we have workplace safety rights that are enforced by an agency called Cal-OSHA. Now, Cal-OSHA hasn't come out yet and said exactly what's going to be okay and what's not under the current coronavirus conditions for warehouses. But the important thing is that fundamentally, your employer has an obligation to keep you as safe as possible. Now, Cal-OSHA requires employers to have what we call an injury and illness prevention plan, which means that if employers are still operating in these conditions, they have to think about what coronavirus exposure to their employees means and figure out how to protect their workers as much as they possibly can. So the important thing is, if you think your health and safety is in danger at work, you need to know that you have the right to speak up about these issues with your employer. California Labor Code Section 6310 says that an employer cannot fire or discriminate against an employee for making a complaint about workplace safety to the employer or to Cal-OSHA or to your representative. So if you reasonably believe that the working conditions of yourself or your coworkers are unsafe, you have the right to bring this up to your employer and to ask them to do something about it. In some more limited circumstances, you may actually even have the right to refuse to do hazardous work. If doing that work would, for example, would violate a Cal-OSHA safety regulation and would also put you or your coworkers at substantial risk of serious physical harm or death. That's under California Labor Code 6311. Now, we say it's generally best to try speaking with your employer first to see if they'll fix it. And we would strongly recommend that you consult with our organization or Cal-OSHA or an attorney before you went so far as thinking about refusing work. The other thing that's important to note is that Cal-OSHA is not your only option to protect your safety at work. And frankly, we think that the agency may be pretty overwhelmed and slow to respond right now, given the current conditions. The fact is, you'll often be much more effective in getting something changed at work if you can get together with your coworkers as a group and demand something changed. And the ability to do this, to act together with coworkers to try to improve working conditions, is one of your most fundamental and important rights as an employee. And it's protected under federal law by the National Labor Relations Act, or the NLRA. And the NLRA protects the rights of employees to engage in what we call concerted activity, which basically just means when two or more employees take action for their shared benefit or protection regarding the terms and conditions of employment. That's things like wages or safety. Now, sometimes just a single employee can also be covered under the protections of the NLRA if, for example, they're bringing a group complaint or acting on the authority of other employees. But the safest way to think about this is it's when two employees take action together. And as a practical matter, you'll probably have more power and be more successful if at least a handful of you act together in talking to your employer or taking some other action. Now, another benefit of thinking about collective concerted activity is that you're not as limited by what an agency like Cal OSHA says your employer is allowed to do or not. So even if Cal OSHA, for example, says that a certain practice is technically legal, if you and your coworkers still find that it's outrageous or unsafe or undignified, you can still act together to demand that your employer change it. And this is really how meaningful changes in workplaces happens and has happened historically. Now, just to say that even though the NLRA makes it illegal for your employer to fire you or retaliate against you for doing protected concerted activity, you want to be strategic and deliberate around how you do it. For one thing, it can sometimes be difficult to prove that your employer fired you because of retaliation. But I should say that that shouldn't stop you from exercising your rights. You just need to have a plan for how you're going to take action. And so, again, would say you can always contact our organization or similar organizations or attorneys or Cal OSHA for understanding how to exercise your rights. And we recommend that you do that. With that said, I'll turn it back to you, Adam.
Thank you again, Tim. Few things I'm hearing. Obviously, you have a right to call for certain things. You have a right to gather with your coworkers, and these are protected by federal law. I want to make sure folks understand that. And as always, again, we are here. You can message us via Facebook, the phone number directly connected to my profile right now, or you can come to our website as well, Warehouse Workers Resource Center. So thank you again, Tim. And now we're going to talk a little bit about what happens if you get sick at the workplace and your rights through workers' compensation. So we have Steve Scardino of GEC Law. Thank you again for joining us. And thank you, Steve. Take it away.
Thanks, Adam. I'm delighted that the medical side of this was covered, and I'm extremely pleased that Tim really, I think, pretty comprehensively covered your legal rights at the federal level. There's California state right is if you get injured on the job, you have the right to file a workers' compensation claim and have some degree of expectation that your employer is going to take care of you with medical care, potentially and hopefully payment for your time off. That's called temporary disability. And yet we're talking about COVID in this discussion, COVID-19. What's important is that Tim said there's a lot that we don't know about it. Adam said the same thing. I agree. There's tons we don't know about it. Work comp has been around since 1913. 1918 was the Spanish flu epidemic, which was pretty profound. We're all hoping that this is nothing even remotely close to that. We know more about epidemiology. We know more about infectious disease. We know more about precautions. But what's true is that folks that are still working are working where? With other people. And they're working with other people that go home at the end of the day and other people that might be exposed to somebody carrying COVID-19. So if they are essentially importing the illness into the workplace and not only exposing you, but transmitting it to you, and you believe that you are sick because of that, that gives you the right to file a workers' compensation claim. There's case law that goes back to 1933 and arguably earlier than that about whether these things should be considered work-related if you believe they happened on the job. And there's a reason why I said that the second time. It's a case called Marsh, M-A-R-S-H, from 1933. Basically says that the illness has to be associated and incidental to the work, and that it's not enough that the disease was contracted on the employer's premises. Now, I don't agree with that case law anymore, and I think you can distinguish if there's solid evidence that you were not exposed off the job and that somebody had the illness on the job and you were working in proximity with them and there was some method of transmission. So you're sick, you have COVID, you test positive. I won't get into how you treat it necessarily or how you get tested for it. The doctor more or less covered that. But you're in the process. What are you going to do about it if you want to pursue a comp case? You have to file a claim form. It's called a DWC-1 if you're looking for it on the internet. It's a very simple form. It's really half of a form, the top half. The bottom half is for the employer to fill out. If you believe you're exposed, you indicate you're exposed, and you sign it, date it, and you give it to the employer, and by God, keep a copy of it. Make sure that you date it. I said that twice for a reason also. This is, for many people, uncharted. When I say many people, I'm talking about attorneys, doctors, and workers. This is uncharted. Judges haven't seen anything like this. Now, judges have seen transmissible illness cases before. There's valley fever. There's Lyme's disease. There's other stuff like that. But this is somewhat uncharted. So it's always been difficult to prove that if you get a flu, that it's work-related, because you can get a flu anywhere. And that goes to the Marsh case. And the Marsh case is a good word for it because it's going to be a quagmire in that it's difficult to prove. There will be litigation. It's going to be tough going, I think. But if you're pretty sure that you were exposed on the job, you should file a claim. That is the claim form. Mentioning it is probably not enough. And why would I take a chance, right? If you can file a claim, you should do so. Make sure you cut me off when I've hit my 5-minute mark, because I'll keep going if you let me. Bottom line is you want to make sure there's a connection to work. So if you have some pretty credible evidence that somebody has it, that might give you the reason to file it. If you're sick but you're not sure it's COVID, follow the instructions the doctor gave or that your personal doctor gives. My recommendation is that you take care of your health one way or the other, and whether it's work-related or not. Did I hit my 5 minutes?
Perfect, Steve. Thank you again for joining us this morning. So what we've got here, and we're taking some questions, but briefly, because Steve covers that directly, so we'll take it now. Hearing what steps will be taken for our health and safety if there have been cases in our building. And what I'm hearing generally is we need to be proactive on these things. We need to file claims. We need to reach out to certain resources and so forth. We don't know, frankly, how proactive our employers are. In many cases, we're hearing the opposite. And so that's why we're here today. That's why our links are here today. Please forward this to colleagues. Please turn to coworkers again. We've stressed this a few times. Check in with each other to start a shift. Introduce yourself if you need to. Exchange phone numbers. Check in with each other to see how each other's feeling. And then obviously, if any of this resonates with you, any of this that you're hearing jumps out, please reach out to us. So right now we've got more of a conversation about the importance of workplace safety and your rights. So more stuff still. I'm going to turn it over to DeGracia Cornelio of UCLA Labor Occupational Safety and Health, and also a member of the WWRC board. Take it away.
Hi, thank you, Adam. I am also very grateful to be here because I'm an educator and a translator, and it's been hard not to communicate with people. So I want to focus on two questions. The first one would be, how do occupational safety and health policy and knowledge help us figure out what to do in a case like this? And I already, and we all already had an opportunity to hear both policy, what about policy, what does policy say, and what does medical knowledge, public health knowledge says about it. And then the other question is, how could this be prevented? That is what informs all of our programs, all of our educational programs, all of our research, all policy, right? Except for workers' compensation. The idea is that we are all focused on prevention, because once life is lost, then that's it. So when we are teaching, when we are involved in dialogue with workers about what should happen in the workplace, we begin by identifying the hazard. Every training, we need to see the hazard and we need to understand it. So we usually talk about specific things that we know about the hazard. In this case, we know that this is a highly contagious and lethal virus. And what that means is that it is microscopic, you know, all the things we already know about viruses, that we cannot see them, that they enter the body, and that they run their course. And in this case, letting that case just run, letting that virus just run its course, it can, as we know, it's killing a lot of people. So we need to focus on the fact that we are identifying a hazard that we can see it acting, but we cannot see what it is. And as doctors say, we need to know who has it, what surface may have been exposed by that person, what people may have contacted that person. So that's the other thing we know. It is a hazard that is transmitted person to person, and that is now in the human population. And we also know that it's going to be recurrent. So we need to plan for that. It enters the body through our eyes, our nose, and our mouth mostly. And again, I should, as others, do the disclaimer that this is all kind of like working knowledge. There is a lot that we are learning every day. There are people that are focused on understanding this hazard more, but what we know is that it enters through the face, and that's why the insistence that we wash our hands and that we don't touch our faces. And the other interesting and also controversial issue is how long does it live in different surfaces? So I learned recently, and again, this is still open for more research, that they found active, the virus, they found active cells, molecules, I don't even know, in surfaces in the cruise ships that have been already kind of left by people, but that are now an opportunity for people to learn about. And so that's what we know about the hazard. But the other thing we need to focus in is then how come and what is the exposure that different workers have in different workplaces to these hazards. So it's always two things, right? It's first, what is the specific hazard, whether there is a chemical or a biological entity that can enter our body, but then what are the workplace relationships and the workplace conditions that expose some people, and particularly some people more than others. So as the attorneys in this group said, the law says that employers need to act when a hazard is known. And what that means is even though we can't see this hazard, we know it's there. So that brings us to another type of resource or method that we use to identify hazards, which is to do a case analysis. And we don't have time to do that here, but the idea is look at the people who have died in their workplaces. What has happened to them? What has been lacking? Or we can look at whole countries, right? It is our understanding that when we do a root cause analysis, where we arrive is at the fact that people knew that we were exposed to this. Governments throughout the world knew that a pandemic was something that could happen any minute, and they did not come up with an emergency response plan. Now, an emergency response plan is a regulation. Employers are all expected to have an emergency response plan. And that is what we are left with right now because we didn't plan it, right? So we are left with coming up with an emergency response without a plan for an emergency response at a national level, at a global level, at a workplace level. So I leave it to you to look at those cases and seek information and just kind of like go back and ask, how could these have been prevented? Because when we identify the root causes, the whys, then we can think of prevention. And so when we begin to think about prevention in the workplace, the first thing employers have to do is evaluate the hazard. And my sense from what I've learned is that this is an imminent hazard. And my understanding is that federal and government regulations say that when a hazard is imminent and lethal, then they need to respond, they need to intervene, they need to come to the workplace. So as Tim said, we're waiting for the governmental agencies that are in charge to take on that role. In the meantime, what we mean by evaluation is prioritizing that hazard, understanding what are the reasons that make that hazard a priority. And that's why we're asking what is essential. What work is essential, what workers are essential, what knowledge is essential, what needs are essential, and that kind of questioning, right? So that's what follows when we now know the root causes. We are evaluating the hazard, assessing how dangerous it is, how much potential for harm it has, and then we come to solutions. And when we get to that, what I've heard is that the most appropriate advice that I've heard in all my reading nonstop is universal precautions. Universal precautions means, and this is something we've used for bloodborne pathogens in the past, what that means, or bloodborne pathogens meaning illnesses that are transmitted through blood, through contact with bodily fluids of people. And universal precautions call for assuming that everybody's infected and that we are infected and that every surface is infected. And then when we assume that even ourselves can be infected and infect our families and infect the people we love, then we begin to think about what kind of policies and procedures need to be put in place in addition to universal precautions in a workplace. We've been seeing a lot about PPE, and I find that interesting because we usually say in our trainings that PPE is the last tool, is the solution of last resort, because we usually go for solutions, preventive solutions that eliminate the hazard. Then we move on to the ones that reduce the hazard, and then we go to PPE, which only blocks the hazard. It is my understanding from hearing global health professionals that even healthcare professionals in the US are not used to using the masks because because it's not so necessary in the workplace in the United States. There aren't that many infectious diseases. And so this person who worked in the Ebola pandemic was talking about how he got infected with Ebola and how using PPE requires feeding, cleaning, knowing how to take it in and out and all of that. So when we are talking about not being prepared, that's what we mean. All regulations call for training for every worker. And so that's what we are right now. We are using PPE because we weren't prepared and we need to train. And so I'm being told that I need to wrap it up. Trainings need to be more dialogical and provide feedback and help us who are teaching understand the reality better. But I just want to reiterate that when we think about what each party in the workplace, what are their rights and responsibilities, then workers who are now deemed essential need to request the kind of protection that they have to take because they have no choice. Just like healthcare workers, warehouse workers, any service workers, they are making a moral decision to go to work because they have a responsibility to us and to their families. So what I find is that the root causes point to actions that people who were supposed to take did not take. And so it's our turn, it's on us then to take the actions that will help protect our lives and the lives of our families. And that's it.
As always, Dale, thank you very much. I want to underscore something I just heard from her. Root causes point to actions or failure to act by individuals with power and resources to save lives. What that sounds like is let's take our own fate in our own hands. We can do certain things. If anything is jumping out at you in these conversations today, you have our contact information. Again, I'll read it for you. Cell phone directly, we'll answer it. 213-674-0383. Again, 213-674-0383. So we're going to wrap things up. Again, thank everybody for joining us this morning. Want to make sure that folks remember that there is no clarity about what the best practices are for this disease, but we need to protect you as workers for your health and because you're a critical part of our community, obviously. To say the last 2 weeks have been interesting is to put it mildly. You know, I sense that video conference gatherings such as these are becoming the flavor of the month, but secretly I'm hoping we can return to just gathering soon.
Adam.
That being said, during our recent video staff meeting, someone said something that really stayed with me. They said social distancing, is that really what we need right now? Or is it more just physical distancing while needing social solidarity now more than ever? Physical distancing, but social solidarity. So friends, family, and again, we'll say it, coworkers, yes, coworkers, right now, turn to each other, check in with each other often, now more than ever. If there's one thing I'm personally certain of, it's that we must stand in solidarity with the working class now more than ever. Class seems to be a taboo word these days, but let me explain a little bit. It is the working class currently holding our society together during a global health pandemic, is it not? It is the working class, as in healthcare workers, who will always have a special place in my heart who continue to risk their own health and safety to care for us all. It is the working class, as in workers who continue to provide us with basic necessities we need to survive. And I'm not talking about toilet paper, although I am running a little bit low. Now more than ever, I don't see millionaires and billionaires. I don't see corporate CEOs holding our society together. Now more than ever, everywhere I look, I see members of the working class holding us together. So thank you for attending. And again, please contact us by any means. If you have any questions whatsoever, we care and we're here for you.
Adam, I can't close out better than that, but I just wanted to take a second to circle back to a question that was posed by a viewer. And please, if people are still watching and want to submit more questions, we can entertain those a little bit longer. But someone had asked what's going to happen to protecting at work if there are cases in my warehouse or my workplace. And so I just wanted to talk about that for a quick minute because we know that that's happening. So as I said earlier, Cal OSHA hasn't come out with specific guidelines yet for warehouses and coronavirus. I think they may soon, and so we will circle back with more information on that if that happens. But they have basically said that employers should be looking at the CDC guidelines for employers on keeping workers safe. And so those CDC guidelines include things like if a worker is showing symptoms or if they're sick, they should be sent home and separated from others at the workplace. We would say they should, of course, be paid if they're sent home. The employees should be encouraged to be washing their hands. There should be good sanitation practices. So your employer should be thinking about things like that. And again, as Adam said earlier, if you're working so fast and so hard you don't have time to wash your hands, that's running kind of contradictory to the recommendations of doing that on a regular basis. As I mentioned earlier, also, under Cal OSHA rules, your employer is required to have an injury and illness prevention plan, which means essentially that they need to be actively analyzing, hazards that might be coming up at work. And I think at this point, coronavirus is a pretty obvious hazard that an employer is going to have to be thinking about if they still have people working. So, they need to be thinking about the risk and assessing, if there are cases at work, what are they going to do? What are the steps they're going to do to take care of that? I know we've seen in other states that some warehouses have temporarily closed. But I don't know if that's going to happen here. And like I said, I can't promise that Cal OSHA is going to say your employer has to do any specific X, Y, and Z of these things. But these are kind of like guidelines of best practices that are out there from the public health perspective. And your employer should definitely be thinking about them. And you, again, have a right to ask your employer about what they're going to do. If you feel like you're being exposed, working next to people who are sick, you don't have protection, anything like that, you can talk to your employer about that. And again, if you feel like your rights aren't being respected, file a complaint with Cal OSHA, reach out to our organization, find another attorney to talk to. As Steve said, this is a totally unprecedented situation in terms of how the law is going to respond, but don't forget your fundamental rights and right to speak up about whatever is going on and to get help to do that.
And if I may add, a best workplace practice is to involve workers in decision-making in that injury and illness prevention planning. So as to be involved, this is an emergency. Decisions must be made collectively.
Excellent. Thank you, everybody. We'll take a brief pause. If anybody wants to send us a question via live stream on Facebook, we'll give you that opportunity. We're getting live updates of anybody who submits questions. In the meantime, before we wrap, other folks who want to jump in, other points, other things we want to underscore other than what's been shared. To summarize for folks who may be joining us late, we had a physician sharing with us medical information about COVID-19. We've additionally had our legal director talking about your rights and protections under the law. We've had a workers' compensation attorney share with us what your rights are if you are injured. We've had Dale, our board member, share the need for many, many things, including the fact that social action and social solidarity and being proactive in these things is necessary. And ultimately, I've sort of shared that it is the working class. It is us that is holding society together right now. That's never been more evident than when you go places or when you receive things that you've ordered because you cannot go outside. And now more than ever, we as the public need to stand in solidarity with the working class. We as members of the working class need to turn to each other Yes, physical distancing, but social solidarity. Turn to each other, check in with each other, share contact information with each other, make sure that we're connected, and in moments of need, we're there for each other. Other questions we see, or other comments before we wrap?
One point, we discussed this beforehand, I forgot to mention it. It's a glaring omission from what I mentioned before, which is you're working with people, you may be working with people who are sick or exposed. That's stressful. That's a volatile situation, working 12 to 15 hours a day, 6 or 7 days a week, under the stress of not knowing whether you've been exposed to what is basically an illness. It's poison, it's dangerous. I'm not encouraging people to file comp claims. If you've been injured, if you've been exposed and you're sick, you should. But I want to acknowledge the human component. That is stressful and that is dangerous and it takes a toll on your health. Thanks so much, Adam.
I want to piggyback on that and say that we are right now in the occupational safety and health community discussing what is violence. And so I pose that question. Isn't expecting somebody to face this lethal hazard because they have to work for their families, isn't that workplace violence?
Thank you again. Anyone else before we wrap? All right, please share this with everybody, anyone you think can benefit from it. And again, most importantly, the action component. So we provided some education this morning, as is our mission statement, some advocacy, but ultimately it's action. If any of this resonates with you, if any of this sounds familiar, if any of this concerns you, let us please touch base with each other. I'm hearing one more thing. Okay, can workers go together to ask for time to wash our hands as often as we need to as fulfillment center workers? We are touching cardboard, metal, and plastic, which can hold the virus. So I'm going to defer to our experts on that. Can workers go together to ask for the time to wash our hands as often as we need to as fulfillment center workers or workers elsewhere in warehouses?
I'm just going to say that it is important to, that's where the physically distant and socially close mantra comes in. Like, as long as people are careful, because the minute you get a lot of people together, then you are multiplying the hazard. But I'll leave the legal aspect of that to the attorneys.
Yeah. Anyone else want to weigh in?
Like I said before, you do have the right to speak up about unsafe conditions, and it's better to do it for workers to do it together. Like I said, it's not clear if the law is going to require your employer to grant that request of as much time as you want throughout the day. But again, given the recommendations of employees practicing frequent hand washing, that seems like a real safety issue. And again, not giving you specific advice on your situations, you have to know the whole context. But again, generally, you can speak up about something you feel like is unsafe at work, and you can, make specific requests about what you think would make the work safer. And you can, it's always better to do that in a group.
Excellent. Thank you. Anyone else on that before we wrap for the morning?
I just want to say that Tim reminded me of the right to know. We have a right to know.
Absolutely. Any questions, anything else folks need to know? We are here. Our contact information is here. Facebook. We're also on Instagram.